Radiation is probably been more misunderstood, and more fear has been generated than probably most other therapies one can think of. However, it is an extremely effective way to kill cancer without damaging normal tissues in the body. One of the really wonderful features that we have here at St. John's Hospital is we have the neurosurgical clinic right next to the radiation oncology department. So we work very, very closely with Dr. Kelly and Dr. Barkadarian to decide, one, whether radiation is needed or not in this situation, two, what form of radiation that we would recommend.
There are certain tumors that we cannot completely remove, either because of their consistency or their location. These are tumors that are typically stuck to nerves, wrapped around critical blood vessels, or adherent to the brain itself. Fortunately, in these patients, we have an ideal second-line treatment in radiosurgery or focused radiotherapy, which has a very high success record.
Once Dr. Kelly has referred a patient to our department and feels that they would be a candidate for radiation, we discuss the case thoroughly and of course review all the scans, the images that led to the patient's diagnosis.
We are very fortunate to work with Drs. Woolman and Chaikin and their team in radiation oncology. For each patient, Dr. Kelly or I perform the treatment planning with Drs. Woolman or Chaikin to provide the maximum safe dosage of radiation to each tumor.
Radiotherapy is extremely effective at getting rid of a few cells that may be left behind at the edges of an area where a surgeon does his operation. There are many tumors that are treated just with radiosurgery, particularly if they're quite small.
Patients with metastatic brain tumors form a large part of our radiosurgery practice. In many patients with metastatic brain tumors that are deep or surgically inaccessible, stereotactic radiosurgery can help treat these tumors. This is a highly effective outpatient procedure that allows patients to avoid open brain surgery.
I had about 3 months off, and then they put me through radiation, which was here at the hospital, 6 weeks of radiation, 30 sessions. There's a machine here that would address and pinpoint precisely where mine was, so there would not be any risk of any other issues.
Stereotactic radiosurgery is really a team approach, and we have the team at St. John's Health Center and the John Wayne Cancer Institute. We have the neurosurgery, the radiation oncology, our physics, which is part of our radiation oncology, our oncology-trained nurses, and our very well-trained and experienced technicians that will deliver the treatment to make sure that everything is done in the most precise, meticulous, and safe way.
Radiation, when most people go through the radiation, they have almost no side effects, and they realize this is done with no knives and no needles and is completely non-invasive. They generally walk away feeling, wow, I didn't know that this could be so easily tolerated and effective at preventing the cancer.